Yeah.
There they come.
Welcome, welcome, welcome in. Welcome everyone to Care Concierge with Care Patrol, where education is the heart of everything we do. And we appreciate you being with us today. The weather is cooperating lately, although we're getting rain, we're getting what feels to me like fall weather. I hope you're enjoying it. Thank you for spending the lunch hour with us. If you're new to Care Concierge, thank you for joining. We'd love to have you participate in discussing with us. You can use the chat room in Zoom to do so. If you're new to Zoom and you're not familiar with the chat, take your cursor, move it to the top of your screen or to the bottom. At some point, a bar will appear with the word chat on it, and enter your thoughts, questions, observations, and outcomes. I know we'll all be blessed by what you have to say. We are accredited by the Alabama Board of Social Work, and we're also accredited by the Alabama Board of Nursing. And each of those entities tells us that today's course is 1.0 contact hour. Nurses will post this for you. Social workers and everyone else who attends, including nurses, will get a certificate provided that you do the evaluation. You will not get a certificate simply by sitting in the class. You must do the evaluation. It's password protected, and we do this because by doing so, we can show to the Alabama Board of Social Work that this qualifies as a live hour and not as a recorded hour. And so our evaluation is password protected. I'm going to read it to you now in case you're not able to pay close attention to your screen or you're appearing on your phone. Make note of this evaluation link, which is https colon / www.surveymonkey.com /lowercase r / all uppercase letters with numbers 6Y, V as in victory, B as in ball, H as in Harry, Z as in zoo, G as in girl. That is our evaluation link for the day. We'll give the password at the end. And now we're so happy to introduce today's speaker, who is a returning speaker with us, who does a really excellent job in explaining sort of Medicare, Medicare Advantage, and other questions. And we do encourage questions to make this more interactive and to hit those points that are really important to you. So thank you, Karen Morse, for being here so much. We really appreciate you sharing your information with us. And I will turn the floor over now to you.
Well, thank you so much for having me. I mean, this is a very tough topic. It's confusing to so many people. I don't know why I love it, but I do. And now I am now on Medicare myself, so I'm very thankful that it's around, but it is complicated and it's not always easy to deal with, especially on your end. Skilled nursing is probably the hardest place for people who have Medicare, but it's a blessing that people like you are out there that can help them go through this program because we're all going to end up needing it at one point if we're lucky. So basically, what I want to do is I want to go through Medicare 101, and if there's time, because we're talking about Advantage today and not Medicare supplements, I will show you how we go through a client meeting and help them choose plans and what we're looking for. So we'll get into that in just a little bit if there is more time. So right now, this is basically called Medicare 101. It's a very broad overview of Medicare. Medicare is a very complicated system. We work with multiple companies around the country. I am licensed in 22 different states right now, and I work with all these companies. I have now been doing this for 15 years. Before that, I helped my parents with their insurance and I took care of our own insurance, things like that. But I grew up with insurance, so I feel like that's just kind of my family curse is insurance. Always done it. It's always been in my life, and it comes second nature to me. But I do understand that it's complicated for other people to understand. So, the main things you need to understand about Medicare is that Medicare is not free. When you work, you pay your FICA taxes. Those FICA taxes go to Social Security and to the Medicare fund. Once you turn 65 or get into Medicare, you become a beneficiary of that program. So it's not just given to you, you've actually paid into the system and now you actually get to use it. There are premiums for Part A and for Part B. So many people come in thinking it's free. It's not free. It does cost you. After you pay your premiums, there are deductibles for both Part A and Part B before Medicare pays anything. Then there's mostly co-insurance on Medicare. Very few things have co-payments. One of the exceptions is a day in the skilled nursing facility. That would be a set co-payment right now of about $217 under Medicare for this year. That's one of the exceptions. Primarily, after you pay your deductibles, Medicare pays 80% and you pay 20% with a few exceptions. So we'll go into that some more. But the Medicare card looks like this. You will have your name at the top, and that name should register the same as what your Social Security card shows. So you've got to understand it's going to show whatever your Social Security is. May not match your driver's license. So you have to make sure it's always the same because anytime you use your Medicare, your name is very important. Some even middle initials, or if you have a designation like junior or senior, whatever, that has to be on any application you do. Below that, it'll show your MBI number, which is your Medicare Beneficiary ID number. It's now alphanumeric, meaning they no longer use the Social Security number for ID. It's all going to be numbers and letters. Traditionally, that should have been the same number from the time you started all the way through life, but there were some data breaches a few years ago, so people got new numbers. So you have to watch out sometimes, rarely, but sometimes those numbers do change. Below that, it'll show Part A and Part B, which says hospital and medical consecutively. And then next to that, it'll show the days Part A and B start. That's about all the information you're going to get on your Medicare card, but it's extremely important that every piece of that information matches whenever you're putting it into any type of insurance system or anything where you need to get payment. Um, Medicare started over 60 years ago in 1965. Truman and his wife were the President Truman and his wife were the first recipients of Medicare. And at that time, it was meant to cover people through the end of their life after they retired, and most people weren't living till very much longer after 65. So it wasn't meant to be as big as it is now. Through the years, people are living longer and longer and longer. And I think by 2030, we're supposed to have over 1 million people turning 100 in this country. So it's obviously lasted a lot longer than they expected, and the fund keeps getting bigger, but there are more people taking advantage of it now because now the largest generation or boomers are all turning 65. We're at the tail end of that group of people. Medicare basically, again, was supposed to cover you from 65 past, but there are some people, and I'm sure you run into quite a few of them, if they develop end-stage renal disease, they may be able to get Medicare in 4 months after starting dialysis. If they have cancer, sometimes they'll go ahead and give it to them before they turn 65. ALS will always get Medicare quite soon. People who have disabilities, they will have to be on a disability with Social Security for 2 years, then they will be eligible for Medicare. So there's different ways to get it when you're under 65, but again, primarily it is for 65 and older. Any questions about that? Okay. The reason that's important, let me go back. The reason this is important about the under 65 is in some states, you can only get Medicare Advantage plans when you're under 65. Alabama is one of those. You have to be 65 or over to get a Medicare supplement. So that's something we're not really talking about today, but I do want you to understand the designation. If someone comes to me and they're under 65, I cannot offer them a Medicare supplement. I can only offer them Advantage plans because that's state law and it differs between which state you live in. If you live in Mississippi, you can get a Medicare supplement under 65, but not in Alabama. So that if you see people on disability and they only have Advantage plans, that's why. Now, Medicare has four parts. Now, you need to understand these are parts. Make sure that word part is extremely important because for Medicare, original Medicare is parts A and B. If you start talking about plans, that's something totally different. But A says hospital on that Medicare card. But under hospital is also skilled nursing, home health care, and hospice, which is primarily where you're working. So that's all covered by A. Now, that doesn't mean that that's paying the doctors and that type of thing. The doctors are all under B, and it'll say medical on the card. So any doctor you see while you're in the hospital or the skilled nursing facility, any tests they run, your yearly physical, and any durable medical equipment like a bed or cane or even a diabetic monitor, that falls under B. The only other things that fall under B would be chemo treatments, infusion therapies, things that are received at a hospital or a doctor's office. Now, that's it. That's all Medicare covers. And there's no max out of pocket. So that's why we say you have two choices. One's Advantage, the other's a supplement. Because under Medicare alone, if you only have original Medicare, there's no way to stop the cost of care. When you're healthy, it's not a big deal. You're not going to spend that much. But you get sick, like you end up in a skilled nursing facility, there's no way to stop the cost. So that's why the government asks insurance companies to come up with Medicare Advantage, which is Part C. I've heard it called Disadvantage. I've heard it called a lot of names. It's not the greatest, and I know that is not what I'm on personally, but for some people, that's all they can afford. The reason it's there is to protect people's finances. That's the main reason it was developed. The cost to anyone who takes an Advantage plan, though, is that original Medicare is no longer primary. They don't lose their Medicare. Medicare sends money to the insurance company now. So the insurance company has to take care of those patients. And the Medicare doesn't do it anymore. It's just being used to buy health insurance with a max out of pocket. That's its primary function. So whether you love them or hate them, that's the point of an Advantage plan. There's also Part D of Medicare. That's for prescriptions because Medicare doesn't cover them. Anything you would pick up at the pharmacy is not paid for by Medicare. Again, that's through an individual insurance company. Most Advantage plans will cover prescription drugs, but not all of them. So we have two different names for Advantage. One will be MA or Medicare Advantage. The other's MAPD, Medicare Advantage Prescription Drug Plan. The difference is, say you have someone who's a veteran and they're getting all their prescriptions at the VA, they don't need drug coverage. So they may have just strictly a Medicare Advantage plan. Most people that you run into are on Medicare Advantage prescription drug plans because they have to have prescription coverage as well. And you cannot get it separately under Advantage in the state of Alabama. If you've ever worked in other states, you may be familiar with cost plans or um, Medicare savings plans or PFFS, which is private fee for service plans. Those are all different type of Advantage plans who allow you to get separate prescription drug plans with your Advantage plan. We don't have those here in the state of Alabama. So right now, most of the people you're going to run into, unless they're veterans or some other type like that, they're going to have MAPDs. So they'll have C will cover all the cost under A and B plus add D. So that's also called all-in-one plans. Any questions about that?
What was it called again?
Medicare Advantage Prescription Drug Plan,
MAPD. I got you.
MAPD. And that just means that the prescription's built in. That's all it means. All
Okay.
right. So now down to the cost. This is this is always shocking to people because for some reason, and I don't know why, we all assume that Medicare is free, and it's not. Part A is $565 a month. If you paid into the Medicare system or the Medicare fund through FICA for at least 10 years or 40 quarters, then you don't have to pay for Part A because you paid for it up front. And they'll take the money out of that fund to send it to whichever insurance company you end up with. But if you didn't work for 40 quarters or 10 years, you have to pay that cost. So I have people who bring their parents over from foreign countries. They have to be here for 5 years before they can apply for Medicare. And then because they don't have the work quarters, they have to pay $565 a month for Part A. So that's one of the things that's always shocking to people. After that, if you go into the hospital for your bed, it's $1,736 for the first 60 days. Now, that's the deductible. And again, that's the bed. That's not covering the doctors, that's just your bed. And what's really sad is that you could technically pay that 6 times a year. So if you go into the hospital in January, and then you go in May, and then you go in November, you're going to pay that 3 times because it's every 60 days. What's even worse, if you have, and I'm sure you've all seen people who are really ill and they can't stay out of the hospital. If they go in and January, go home, they come back in February, that's still that same 60-day window. So now they start adding those days together and they start counting it. And when they hit day 61, they have to pay $434 a day. They hit day 91, it's $868 a day. They hit day 151, they have no more coverage under Medicare. None. Medicare won't pay anymore. What's even worse is to go to a skilled nursing facility, you all know you have to be hospitalized for 3 days. Then Medicare requires that they take an ambulance to go to a skilled nursing facility or they're not going to pay. Those are the rules. Once they get there, then Medicare will pay for 20 days at no cost to the client. They pay all the bills. After 20 days, they start charging $217 for the next 80 days. That's over $17,000 right there. So very few families can afford that, especially when they're on a fixed income. Because most of my clients that I see are living on a lot of them under $1,000 a month, almost probably 75% of them are under $2,000 a month. So 17,000 is going to break them. They just can't afford it. There are benefits to having an advantage plan because it gives them a stop loss, a way to stop having to pay that. So that's why the advantage exists. But I also think, I was telling Sean earlier, I would like clients to talk to some lawyers about setting up trust because that's another way that can help protect clients from losing everything to pay for their care because we're all going to need it eventually. And that's another topic we'll talk about later. But any questions on the cost of hospitals?
So if I've got this right, and you're on Medicare and you're hospitalized 3 occasions that are 60 days apart, you could pay up to $5,400 in copays, and
That's
then
just
you could pay another 17,000 in rehab.
if you're there for 100 days, yes. And
Wow.
that doesn't include doctors or tests or anything else. That's just the hospital.
And days 61 through 9, well, through I mean, that's a lot of money. $434 a day.
Yes.
We have some questions. Let me catch up to them. Ms. Bonham says, can you explain how Advantage becomes primary? If you
Mhm.
don't have Advantage, then Medicare's primary is her
Correct.
question.
Correct. If you do not pick an Advantage plan, say you have a Medicare supplement and a drug plan, Medicare pays first, the supplement pays what's left over, and then you use your drug plan to go get your prescriptions. If you choose Advantage, then now you are asking the government to sign over your benefits to that insurance company. So they send money from the Medicare fund and from your Part B to that insurance company. So that insurance company is now the primary caregiver. So Medicare's still there, but it's paying somebody else to take care of you. So Advantage is primary.
Then Advantage becomes primary.
hmm It's
Okay.
Medicare's still there. It's just being used to pay for the Advantage plan is
And you
all.
wouldn't necessarily call it secondary because it's not.
It's not. A Medicare supplement would be secondary because Medicare's primary, but Advantage is primary when you choose that path.
Okay. And Ms. Jernigan is asking if we have handouts. Yes, we have this presentation that we'll be sharing.
Okay. Anything else?
That's it.
Okay, let's go to Part B. Okay, Part B is where everybody starts groaning because that does come out of your check. Um, as long as you've paid into the fund, you don't have to pay for Part A, remember? So you do have to pay for Part B. They said there's not enough money in the fund to cover it. Currently, it's $202.90 per month for most people. There are some people who may be charged a higher fee. If your income was over, I think, 205,000 for a married couple in 2024, you may pay $289 right now. But standard is 202.90 per month. And if you're on Social Security, they take it out before you get your check. It covers medically necessary services, meaning, and this is a terrible joke, but they're not going to get a facelift and a tummy tuck on Medicare. Your doctor has to be your best friend. They have to be able to prove that what you need is medically necessary. My dad did get an eye lift on Medicare because the doctor proved his hoods were so deep that he could not see out the side of his eyes. His peripheral vision was impaired. So the doctor proved that he needed a lift, and they did an eye lift for him.
Hmm.
But again, that's up to the doctor to prove. You can't just go in and ask for it. And then it's going to cover your preventive services. That means anything that the government deems is necessary, like your flu shots, pneumonia shots, now COVID shots, and they've recently added shingle shots in there. Those will be covered at no cost, but it has to be something that's recommended by the government. Otherwise, it's not covered. You can go in and have your yearly mammograms, your, you know, physicals, all your physicals will be covered annually. And that's before you meet your deductible. But the deductible is 283 for this year. Now these costs go up annually, so it'll be different next year. But right now, under Medicare, the first time you see a doctor, that's not the hospital, you see a doctor in the hospital, they can charge you $283 that you have to pay. After that, Medicare pays 80% and you pay 20%. But this is where those exceptions come in. Say you go into the hospital and you have to have surgery. First, a radiologist reads your test results before you go and then an anesthesiologist comes in and puts you to sleep. Generally, those types of doctors don't take Medicare assignment. If they don't take Medicare assignment, the government allows them to charge you 15% more than that 20%. That's called an excess charge. And you can see below, there are some states that do not allow excess charges, but Alabama does. And those fees add up. They seem like they're nominal, but they add up quickly if you're sick. So you can see these costs just keep getting higher and higher and higher, and it's astronomical. Sorry, one thing I did want to point out, this deductible here, see it says annual. I keep moving ahead. It says annual deductible. You only pay that one time, unlike Part A. Part A is every 60 days. This one's a one time.
Stacy Jernigan has a question. If you have Advantage plan, can you switch back to Medicare?
Yes, you can always switch back, but you can't always get a supplement to go with it. And so if you're on original Medicare, you're opening yourself up to unlimited bills. And it sounds like it would be a great way to go, just add a supplement, but you have to be healthy to get a supplement. So by the time people are sick, they don't have that option anymore. You can always get Advantage. You cannot always get a Medicare supplement.
I'm confused. I thought you said you had to get Medicare Advantage before you were 65 and you couldn't get Medicare until you're 65.
No, you can get a Medicare supplement at 65, but say somebody decides they're 67 years old and they want to drop original Medicare, drop their Advantage plan and go back to original Medicare and pick up a supplement. If they've been in the hospital in the last 90 days, they take 3 blood pressure medications, they say yes to one health question, that insurance company is going to turn them down. Nobody's going to take them. So they can go back to original Medicare and pick up a drug plan, but they don't have anything to help cover all of these costs. And so if they end up in skilled nursing, their family is going to have to come up with a way to pay all that cost. They go in the hospital, their family's going to have to pay all that cost. Whereas if you have an Advantage plan, at least there's a way to stop the expense. So you have to be really careful when you advise people because you have to realize it's not just about ease of getting coverage, it's about putting more cost on a family when they're already stressed. So that's the way I have to look at it because insurance in the end is a way of managing the risk of cost.
So let me get this straight. I take three high blood pressure medications. Are you telling me I'm not going to be able to get a supplement?
You can when you turn 65 for 6 months. That's called
Oh,
open enrollment for Medicare supplement. After that 6 months, no, you won't get one.
wow. Here's
They're
another
that strict.
question.
Mhm.
Let's see. Amanda Blackman is asking, can a physician be a Medicare provider within the hospital clinic settings, but not outside of there? For example, we were told the transplant doctor my son saw was in network within the Children's of Alabama group, but was not when sending his immunosuppressive drug to an outside pharmacy.
That was the answer is yes, they can be both in and out of network because the contracts the providers sign are based on their office locations. And if they have multiple locations, they can only service one location versus the other. Like I have to, when I go do a search for people and search their doctors, I have to pick which office they're seeing them in to see if they're covered. Not all doctors contract with in all locations, so they may be contracted within the hospital, but not outside of the hospital. Also, it may be the pharmacy that was out of network because not all pharmacies, especially if it's like a compounding pharmacy, those don't take Medicare and they won't work with any prescription drug plan. And down UAB's pharmacy has been out of network with many drug plans this year. So it depends a lot about where you're getting it filled as well.
Is it conceivable that the hospital wouldn't, pharmacy wouldn't be a Medicare? That's not
Yes.
conceivable.
No, it
Oh,
is. Because like I said, UAB, I have a client who was going to UAB and I put her on a Blue Cross, the most expensive Blue Cross drug plan there was. And she called me up and all of her prescriptions were costing a fortune. Come to find out, they're no longer in network with that plan. The client has to go to a different pharmacy if she wants her plan to pay. So that's one of the things we do look at. We always want to try to check to make sure that the pharmacy is covered as well because not all of them will take all plans. And definitely all drugs are not covered. So we try to check that as well. We'll get into that in just a second, but anyway, Networks do matter, specifically with advantage plans for doctors, hospitals, pharmacies, in any lab work, all of that, you do have to be a network. Even with original Medicare, not everybody takes original Medicare, which is what we call Medicare assignment. That's why these excess charges are allowed. Anything else?
That's it.
Okay.
She
Now,
thanks you for answering. It was confusing to her.
it is confusing. It's confusing to everybody. So you're good. All right. So now this is really important because this is something that people are often shocked by, but Medicare itself will not pay for acupuncture. Not very many people here are concerned about that, but people love their chiropractors. Medicare's not going to pay for chiropractors at all. Nursing homes, anything over 100 days is not covered. That's considered long-term care. And at that point, Medicare stops paying once you hit that 100-day mark. It won't pay for dental care or dentures. You're not going to be able to get your teeth cleaned under Medicare. There was a vote to try to get dental and vision covered, and that did not pass. So it still is not covered. Hearing aids aren't covered. Routine eye exams for glasses are not covered. So if you have glaucoma or you have macular degeneration, those are considered health issues. Medicare will pay for that because that's a medical need. But to go get your eyes examined so you can get glasses, it's not going to pay for that. Unless you have cataract removal, and then it'll pay for one pair of glasses. Sadly, usually you don't need glasses after cataract removal, but that's the way it is. It doesn't pay for emergency coverage outside the United States. So I always say, if you travel outside the country, get travel coverage because Medicare won't pay. And it doesn't pay for prescription drugs, which is why Part D exists. We have to get that separately. So that's a lot of things that aren't covered. Any questions on those?
No, those are sort of known, I think. So chiropractic was a little bit of a shock, but
Yeah. Yeah, because they are very popular and it's really sad. But here's Part D. We have to go through Part D to talk about Advantage because it is a part of Medicare Advantage prescription drug plans. But it is still, even when it's built in, it's a separate entity and it's going to have a separate max out of pocket and separate deductibles. So it's a huge part because most of us, when we get older, we all take prescriptions. So you have to understand how it works. This is designed by Social Security. They come up with the deductible, they come up with the required formularies, and each plan has a right to build better plans, but they have to be at least as good as what Social Security designs. So there's a baseline, and they all start there. You don't have to have A and B to get a prescription drug plan. You can have either or and still get prescription coverage. But to get an Advantage plan, you have to have both A and B. If you don't enroll when you are first eligible, say you're turning 65 and you decide to wait till you're 67 because you don't take any drugs, you're going to have a late enrollment penalty. So they'll tell you you don't have to have drug coverage. But the minute you sign up for it, they're going to charge that penalty for the rest of your life. So I had a lady this past year who turned 65 in February and didn't get her drug coverage until this past January. She's now got an $8 a month penalty for the rest of her life, and that will go up every year. They don't let you get rid of the penalty, and you can't just pay back what you missed. It's attached to your cost forever. And that will follow you whether it's a drug plan or an Advantage plan. If you're on Part D, no matter whether it's Advantage or freestanding drug plans, the standard deductible for 2026 is $615. We already know it's going to be $700 for next year. The formulary generally for most plans is tiers 1 through 5, some are 1 through 6, but generally tiers 1 and 2 are going to be generics, cheap generics. Tier 3 will be controlled substances like pain medications, name brand drugs, and very brand new generics. Say maybe like if Eliquis comes out with a generic in a couple of years, it'll start out in tier three because it will be expensive for a couple of years and then it'll drop down to tier two. So that's the way they do the tier system. Tier four is more expensive name brand drugs, and tier five will be specialty drugs like chemo drugs, probably like anything like Humiras and the very expensive drugs to treat rheumatoid arthritis, things like that. Those are considered specialty drugs. A lot of times we'll have tier six will come in and it might be drugs that are, some companies are putting drugs for weight loss or diabetic support medications like Mongeros and Ozempics and things like that. Those might fall into a tier five or six, depending on the plan. The premiums are charged based on, um, I mean, each plan has a different premium for it. And again, they can set their own premiums. And we have plans that start at $0 a month on prescription drug plans, all the way up to $130 a month. And that's just drug coverage. And if you get it in an Advantage plan, it's built in usually for free, but it still has to follow the same rules. Now, a few years ago, we had what we called a donut hole that closed as of 2025, and there is no more donut hole. So now we only have three phases. You start out in the deductible phase. Some plans charge that $615 on all drugs, tiers one through six, until you spend $615. Some may only charge it on tiers three, four, and five, depending on the plan you choose. They have the right to structure it, so you have to be careful in picking a plan. So you got to know which ones do and don't work. After that, you have copays, and you pay those copays until your cost this year is $2,100. Next year, it'll be $2,400. That sounds like a lot of cost for drugs. But up until 25, people were spending about $4,000 before they hit catastrophic coverage. So they kind of cut it in half. They cut the cost of drugs in half, which is a blessing for a lot of people. Now, once you spend this $2,100, you enter what they call a catastrophic phase. So this is another way to look at it. In the deductible phase, you're paying 100% of the cost. Then when you get through that, you have a copay and the insurance company pays the difference. Once you spend your $2,100 this year, the insurance company pays 100% of the cost for the remainder of the year. And if you see people who are really sick, you know they can hit that $2,100 really quickly. It does not take long. I have people who may hit it by February because of one drug that they're taking. I have other people who will never ever hit that limit. But if you're on tier one and two drugs, you're never going to even get through this phase. But it is nice that there is a way to stop that cost now. So, any questions on that?
We have a couple. Patricia Knight says, I had been told that the drug penalty had been discontinued by President Trump. Was it resumed or was it never discontinued?
It was never discontinued. It's still in effect.
Mary Sella says, if your 67-year-old spouse in on your insurance through your work and has Part A only, should they also have Part B? Or excuse
That's
me, should they also have Part D, or can Part D wait until they are no longer on spouse's insurance?
that's a great question. As long as their plan is considered credible coverage by the government's terms, then by all means wait. You don't have to do anything. But when you do decide to drop that group plan, you have to get proof from the employer that you've had credible coverage. If you, that negates the penalty. For B, there's a penalty for B as well, but that will negate the penalty for B and for D. As long as you've got group coverage, wait. But for anybody else, if you don't have it, you've got to have some type of drug coverage somehow because those penalties just get higher and higher every year.
Another question. Audra Essig says, when clients only enroll in Medicare Part A plans and not get Part B plans for their outpatient services, do they get a lifetime penalty when they go back and enroll in Part B plans after
Hmm.
their original sign-up time, or
Yeah.
is it dependent on how far away from original sign-up they are?
They can sign up, but they do have a penalty based on when they originally were eligible for Part B. So if you were eligible for Part B at 65 and you wait until you're 67 and you don't have group coverage, you cannot sign up until January of the next year. It starts in July of the following year, and you will have a 10% per year penalty for every year you didn't have coverage that will follow you for the rest of your life. On drug coverage, it's 1% per month of the national average that will follow you for the rest of your life. So there's two different penalties. And yeah, they're steep.
Does it have to be group coverage? I mean, I'm self-insured. Is that credible?
No. If you have an individual plan or even Cobra, they won't allow that. It has to be current employment coverage. It's the only one that they allow to be an exception. So um, sometimes even if you are with the VA, they're going to insist that you have Part B because they put that into um, effect a few years ago. You have to have Part B or you can't go to a doctor at the VA anymore. You have to have B if you're in a small group with less than 20 employees. The companies don't have to pay for your doctors unless you have Part B. So it depends on the company that you're with and how many people are literally employed with that company for it to even count. So the rule is employer coverage is the exception, um, nothing else. Anything else?
That's it for our questions as of now.
Okay. Now, Medicare Advantage is why we're here. So this is Medicare Advantage covers A and B. Medicare Advantage prescription drugs are going to cover A, B, and D. They also will give other benefits in there. So to get a Medicare Advantage plan, you have to have A and B, both. Then you have to live in a service area. So the plans in Birmingham are different from the plans in Huntsville. There's plans you can get here you can't get there because it's based on the county you live in. And those change every year. Some companies or carriers are going to have plans in the entire state. Others may only have them in a few counties. So we always have to look, whenever we talk to a client, we start with what's your zip code and which county do you live in? And it's based on the county they pay taxes in, property tax. So it can be confusing if you have somebody who lives on a border, like I'll have 35094 as Leeds, right? That zip code, I know that's Leeds. The difference with Leeds is that can be three different counties. That can be Shelby, it can be St. Clair, and it can be Jefferson. So the plans that are available are based on which one they actually pay their property taxes in. Does that make sense? So if you see somebody and they've got this great plan, there's a fantastic new plan that's down in Mobile. It's only available in Mobile. People want it up here. It's what they call the med sup killer in terminology that's for salespeople. It's the benefits are so great that people are leaving their Medicare supplements to take it. Well, it's only in one county, so nobody else can get it. It's crazy, but that's just the
More
way.
questions.
Go ahead.
Mary Sella says, if your employer offers Advantage plan to retirees, should you also look at supplemental or stick
Yeah.
with what the employer offers?
That's a good question, and that's going to be a very personal question. Um, PHIP is a group employer plan for it's Advantage, pure and simple. It's an Advantage group retiree plan. It's great coverage. Most of the time, I encourage people to take PHIP, but I have had a few people who came in and they wanted better coverage than PHIP, and they didn't mind how much it cost them. So they took a supplement instead. But again, that's going to be a personal choice, and it's different for every single person. Even a husband and wife may make different choices. So you always need to look at what the coverage is and make sure it's going to fit in your um, basically in your budget and that you can afford to pay the cost incurred. Because even though Medicare Advantage gives you a max out of pocket, you still have cost. that you have to pay. So we say on a supplement, you're paying up front for the best care. On Advantage, you're paying as you go. Even if it's a group Advantage plan, you're paying as you go, and you have to be able to manage that cost. So I have a lot of people who will come in and their supplements gotten so expensive they want to go to Advantage. I encourage them because they have a 1 year trial period to do this. I want them to save all the premiums that they're not paying for anymore in case they get sick and make sure they keep that because we never know when the other shoe's going to drop and you're going to hit your max out of pocket. You're going to need those funds. It's not just going to be so you can ease up on your budget. It's You've got to be careful when you go to Advantage because they're cheap to purchase, they're not cheap to use.
That's interesting. Patricia Knight says, what about if you have had something like Medishare? How does that affect your timing for signing up for Medicare parts?
You need to do it as soon as you turn 65 because it's not going MediShare is not considered credible coverage. It's great company, and I have worked with them before. But it's not going to count as credible coverage. So you need to get Medicare A and B and D as soon as you turn 65 to avoid the penalties. Anything else?
That's it for now.
Okay, so back to this little button here that says other benefits. That's things like dental, vision, hearing, car rides, food benefits, over-the-counter options. All of these things that fall under other benefits are gifts from the insurance company. They're required to spend 80% of the funds that they bring in to take care of people. And so they will add these extra benefits that Medicare doesn't pay for just to help people out. And that's why people love them because they don't have to pay so much money and they get lots of extra benefits. People love them until they have to get into a skilled nursing facility or they're trying to find a doctor and they can't go because they're not in network. Then they get frustrated. But for the most part, it's crazy, but most of my clients absolutely love Medicare Advantage. But I've had to deal with some that ended up in skilled nursing facilities, and it is hard. It's really hard. That's the worst part of it. But it is something that I wish I could fix. But I mean, it's just know people love their Advantage plans. I have people I really when I meet with them, I give them the choice of going Advantage or supplement. I always encourage them to take the supplement when they're turning 65. And it always shocks me when they choose Advantage. And I will tell you, I get paid more for Advantage than I do a supplement. But I encourage a supplement over an Advantage plan. This is just for y'all's information because I know how hard it is if something horrible happens to them or if they need to see a doctor that's not in the network. It's hard. But at the same time, so many people can't fit that cost into their budget. And that's why they go Advantage, it's because they're cheap. So, and that's if that happens, then we have to go in and try to search the one that's going to work the best for them. So, the differences here are a Medicare supplement, you have to pay Part A and B, and you have additional premiums you pay. You can go anywhere you want to go, see any doctor that takes Medicare that you want to see. You have to add drug coverage to it. And if you want dental and vision and hearing, that's extra too. So I'll share my own cost. I'm paying for my Part B, and then on top of that, my Plan G is $180 a month. My drug plan's just under $4, but I have to pay $70 a month for dental, vision, and hearing. That's a lot of extra cost for the best coverage. Whereas if I'm on Advantage, I can get all of that for zero cost added. So Advantage is very alluring to a lot of people. The difference is on Advantage, they have to be an A and B. They have to pick a primary doctor in most cases, unless they're a PPO, but even that, a lot of times they want a primary care provider. They can only enroll at certain times a year, and you've got to make sure you get one that has prescription drugs built in. So with Advantage plans, the annual enrollment period is October 15th to December 7th. Every year you get an option to switch. So that's when we do our best to pick out a plan that's going to work for the following year. We can't foresee all things that are going to happen. We just have to do the best we can to pick one that's going to do the best at the time of life they're in currently. Then in January to March 31st, we're not supposed to advertise. But if someone comes to us on an Advantage plan, so they chose a carrier A, and all of a sudden their doctor fell out of the network or their drugs are no longer covered, we have one time we can switch them to another plan. Or they can drop an Advantage plan and go back to Medicare supplement and a drug plan if they can pass underwriting. And that's a one-time option during that time of year, and that's called open enrollment. And they just brought that back a couple years ago. After March 31st, we're in what we call lock-in period, and you can no longer make any choices, even if you have Medicaid. So it used to be if you had full Medicaid, you could switch every month. Then they went to you could switch once every first quarter or for the first 3 quarters. Now they can't switch after the first quarter either. Nobody can switch after the first quarter, with one exception. If you have someone who comes in and they have a chronic illness, they're diabetic or they have a heart condition, there are new plans in Alabama called chronic special needs plans, or CSNP for short. Those they can sign up for, they can make one change anytime during the year and sign up for one of those Advantage plans. But they have to get their doctor to verify that they're sick.
Kelly Williams has a question. I'm a little unclear. She's the 60-day change of life circumstances not count.
Not in Medicare. Mm-mm. There are different ways that you can qualify for a special enrollment period. Say you pick a plan, that plan I talked about that's in Mobile. If you signed up for that, but then you moved to Birmingham, you would have a special enrollment period for 60 days that would allow you to change because you moved. Um, if you, I mean, it's something like that. It has to be a specific reason. And when we do our enrollments, we have to check. There's like 4 different lists that we have to choose from of a special enrollment period. And if you can't pick one that works, the government won't approve it. So all these changes have to be approved by what we call CMS, or Centers for Medicare and Medicaid Services. And they're very strict. Um, if someone misses annual enrollment period, October to December 7th, because of whatever reason, maybe they had a weather-related incident, they went through a hurricane, they get a special enrollment period due to weather, as long as it's been on the FEMA list, then they can go in and make a choice later for a certain period of time. That's a disaster code. But those, they have to be able to show that they lived in that area during that time and they didn't make a choice, and it has to be coded by the government. So all these SCPs are very strict, and just 60-day loss of insurance isn't good enough.
Westland Benton says, I'm attending a seminar at our local library on Medicare and navigating it. What I'm hearing you say is stick with Medicare supplement versus Medicare Advantage, correct? I am 62 in Lee County.
I would go, I personally try to encourage everyone to go to a Medicare supplement. Again, not everybody can afford it. So and it's a personal choice, and I can't make that choice. I can give you the 2 options and tell you this is what I would do, but at the end of the day, you have to make that choice. So if that's for me, Medicare supplement was the only choice I wanted to make, because I like to travel and I don't want to be told I can't go see somebody. If I want to go to a doctor, I want to go. I don't want to have to say, "Oh, well, you take my insurance." I just want to go. So for me, that freedom is very important, and I'm willing to pay for it. If you're not willing to pay for it, then definitely go Advantage. But just know that that premium goes up every month. I mean, every year. Because in Alabama, the cost of Medicare supplements is based on your age. And as you get older, it gets more expensive. Yes. So eventually that cost gets to be prohibitive, and then it doesn't make sense to stay on it. So if you're Like if you're 86 years old, there's no point in you paying $500 a month for a Medicare supplement when you can get an Advantage for zero with a max out of pocket of $4,800. It just doesn't make financial sense anymore. But the cost then is you have to be in a network and you have to abide by their rules. So there are costs to Advantage. So
Mary
the other,
Sellis says, what is the price range for supplements?
oh, well, right now you can get, I just signed a lady up for a plan N yesterday and it was under $100. She's turning 65. But a plan G, which is the best that you can get right now, was 156 a month. And that's with a household discount. If you don't
And
have
then
a discount, it's more.
you're still paying Part D on top of that, and your
Correct.
premiums and whatever with Medicare A and
Correct.
B.
Correct.
Okay.
So yeah. So it's all separate costs. So your all your coverage is you've got 202.90 for plan for Part B. Plan G would be 156. The drug coverage was $3.60, and dental coverage is $68. Dental, vision, and hearing. So
300 a
all
month.
those, that's a lot of money, but it's the best care. And it's complicated, but I'll show you. I mean, when I go to the doctor, I have to show my Medicare card because it's primary. And then I have to show my supplement card. That's doctors and hospitals. And then when I go pick up prescriptions, I have another card that pays for my prescriptions. And if I see a dentist, I have another. When you have Advantage, you've got one card, you walk in there, you hand that over, and that goes to all of those sources at one time, and you just pay your copays. So it's less complicated, but it's just a personal choice as to which way you go. Now, this portion is talking about expenses, and there are a lot of people, like I said, who have low income. And for those people, there are programs out there that will help cover some of the cost. So for prescriptions, if they qualify, that's the highest level of help. They get help through what we call extra help from Social Security or low income subsidies. That will usually pay for most of the premium on the Part D plan, and it will lower the cost of the drugs. Plus, it can negate any penalty if there is one. But it's based on income. And so for an individual, I think their total income has to be below $1,955 this year. For a couple, I think it's 2,700 and some, it's just over 2,700. So they have to prove their income. That's the first level. The second level is administered through the state Medicaid office, and that's the Medicare Savings Program. All states have one. If your income is even lower, and I think it's just over 1,700 right now, then the state Medicare Savings Program will pay Social Security for your Part B premium. So you no longer have to pay the 202.90. If your income is even lower and it's just over 1,300 right now, then you also get Medicaid. So then you would have all three. You'd have extra help from Social Security, Medicare Savings is paying your Part B, and Medicaid would come in and pay your medical bills. Again, it's all based on income and that changes year to year. So the amount that you earn goes up every year whenever the cost of living is stated in January. They'll announce how much you have to have. So, and I have people who are on the line and they go in and out and in and out. So when they're here, they don't have any medical bills. If they lose their full Medicaid, all of a sudden they're paying co-pays and co-insurance and it gets expensive. And it's really hard to adjust, but it, it, that's the way it works. Now, we help people do those applications. I do them all the time. So if you need help with those, just let me know. Um, Beyond that, again, open enrollment is coming up. It's October 15th to December 7th. We can review plans from October 1st to the 14th. We cannot take an enrollment until the 15th. We can't talk about new plans until October 1st. We have to sign a piece of paper with every carrier saying we're not going to discuss what you're offering until October 1st. But after that, we can go through everything, and then it's on after December 7th, whatever you have, whatever you signed up for, that's what you have for the next year. Unless you want to make that one change during OEP, then you have one more opportunity to switch.
Is
It's a
that
lot of,
one change a lifetime, once in a lifetime?
No, per year,
per year.
per year. So
Margaret Bonham
it,
asked, are Medicare savings programs open to everyone or of certain incomes?
Medicare savings programs are offered in different states. We don't have one here.
Okay.
So Alabama just doesn't have one. It's not, I mean, if you move to a different state that has one, you can definitely enroll. There's no requirement.
Okay. That's it for our questions.
Okay, well, here's the other things you need to know is whenever you sign up for Medicare, it has to go through Social Security. So if you are already on Social Security at 62, you will receive your Medicare card 3 months before you're turning 65. It will be automatic. If you are not, if you're still working and you have just Part A, or if you are not on Social Security, you actively have to go in here and enroll. And then you get your Medicare card about 30 days after it's been submitted. Medicare.gov is a great resource. We use it like you can sign in there, set up your account, and it'll show your explanation of benefits. It'll show the plans that you currently have. You can print temporary cards, order new cards. It's very nice to use for you to keep, it keeps up with all of your information. It makes it easy to search. The downside of Medicare.gov searches to pick out an Advantage plan is you can't tell if the doctor's in a network or not. You can show them your prescriptions. You can show them the pharmacy you use. You can't put in your doctors. So that is the downside of using that as a search tool. So time is up, but I mean, we use a search tool that lets us put in doctors to narrow down that search so it makes it easier and make sure that we know they're covered.
Amanda Blackman has a question. Any idea who I can talk to about Medicare coverage and Part D for my 3-year-old son? He has been on Medicare since he was 5 months old due to ESRD, and nobody with Medicare seems to understand how he can have it. I
Well,
get
it's
little
because
to
he has
no help.
ESRD. Yeah. That's why he has Medicare is because end-stage renal disease is ESRD, and that automatically, after again 4 months of being on dialysis, qualifies you for Medicare. That's why he has it. And so, yeah, he just needs to pick a drug plan, and I'll be glad to help with that if you want to. Just let me know. Drug plans are fewer and further between these days, but they're necessary.
Okay, so you can help, Miss Blackman.
Mhm. Yeah, just let me know because right now you can't pick anything now unless he just got it. But I think you said he's had it for a while. He's had it since he was 5 months.
Right.
So we have to wait until October 1st and then we can review and pick one. And then on the 15th, you can submit an application.
Okay. Well, thank you so much. It's been really a lot of information and I've enjoyed it. I hope everyone else has. Thank you as always, Karen. I really appreciate you sharing your time and information and knowledge with us.
Well, you are welcome as always. And I know it's a lot, so always contact me if you have any other questions. I don't know everything, but it gives me an opportunity to learn every time somebody asks me something. So I appreciate it.
Thank you. And y'all join us again in 2 weeks. We'll be back with Peter Jackson, who will be sharing a grief workshop with us and what happens next. You can go to carepatrol.com and look for the calendar and sign up. Thank you for being here today. Hope y'all have a great couple of weeks and hope to see you soon. Thank you, Karen.
Thanks, guys. Talk to you later.
Bye.